I'm Dr. Joy Steadman, and if you're watching this, then you want to know something about your upcoming joint surgery for the upper extremity. That includes your shoulder, elbow, wrist, and hand. Now, typically for those surgeries, we do a nerve block, and the nerve block is done with both an ultrasound and a nerve stimulator to make it as safe as it can possibly be. We want to make sure that we put the medicine exactly where it needs to be, and also to watch the medicine as it goes in to get a good surrounding of the nerve plexus. Now, when we're talking about shoulder surgery, we put the medicine up here where the brachial plexus, that is the nerves that take care of the shoulder, we put the medicine in right about here with a very small needle. We're going to make your arm jump involuntarily using a nerve stimulator, and we're going to watch the medicine go in with the ultrasound. This enables us to put exactly the amount of medicine that we want where we want to put it. For shoulder surgery, we make this part of your arm numb. Sometimes some other things get numb too, however. For instance, some of the nerves of the face can be affected, and this is called a Horner syndrome, and it's temporary. It goes away as the block goes away. And what happens in some patients is that their lid will droop a little bit, they'll get a red cheek, the voice will sound hoarse, and the pupil might be a different size. And I just want to emphasize that this doesn't mean that the patient has had a stroke. It just means that this is a temporary thing called a Horner syndrome. It will go away as the block goes away. Another nerve that can be affected is the phrenic nerve. You have a phrenic nerve that runs through the right side and the left side. And the phrenic nerve runs to the diaphragm. And if the phrenic nerve picks up some of this medicine, it affects how the phrenic nerve moves up and down with that diaphragm. It doesn't affect your lung, however. It doesn't typically cause most people to have any breathing problems other than a sensation of they're not breathing as deep as they normally do. Now, for places that are below the elbow, we're going to go to a supraclavicular block or an axillary nerve block. And these blocks use the same technology. We're going to make things twitch. We're going to make the hand jump involuntarily or the elbow jump involuntarily. And we're going to put the medicine exactly where we want it. These blocks typically last anywhere from 12 to 36 hours, and we do the block under sedation so that you're not awake while you're having it done. You're pleasantly sedated. Most people do not remember getting their block. I hope this answers some of your questions that you have about your joint surgery and your upcoming anesthetic. I'm sure you'll still have more questions the day of, and we're happy to answer them. Thanks.